In 1976, millions of Americans watched Sybil, a TV movie based on a blockbuster book of the same name.
Sybil really introduced the country to the notion that someone could have multiple personalities.
Said to have 16 distinct personalities, Sybil had a story that was emotional and terrifying.
It's me.
So how did a rarely diagnosed psychological disorder turn into a cultural phenomenon?
Sometimes the media is the brilliant hysteric in the mix, and that can be the problem.
In the early 1950s, two doctors stunned the public with a patient they called Eve. Eve was a housewife from Georgia who appeared to have 3 distinct personalities.
No psychiatrist in the United States in 1954 was unaware of this case,
Including Dr. Cornelia Wilbur and a patient she was treating in the fall of 1954 named Shirley Mason, who would later become known as Sybil.
What we know is there was something seriously wrong. She didn't have a normal life despite being so intelligent.
Mason had met Dr. Wilbur 9 years earlier in Omaha, Nebraska. Even then, Dr. Wilbur had been interested in multiple personality disorder.
and she even recommended that Shirley read a classic book about multiple personality.
Then, several months after their therapy began in New York, Mason arrived at Wilbur's office acting different.
She came in seeming very little girlish, and she said something like, "Hi, I'm Peggy."
To explore this further, Wilbur began an aggressive treatment similar to one she had used as a young psychiatrist. Back then, she would delve into the unconscious mind by injecting mentally ill patients with hypnotic drugs, or so-called truth serums. Now she used this technique on Mason. Dr. Wilbur ultimately identified 16 distinct personalities.
There was a little girl who called herself the grandmother. She had a little boy personality named Mike. There was Vicky, and she had another one named Peggy Ann.
And Wilbur had a strong suspicion about what caused Mason's other selves.
Dr. Wilbur was looking for trauma. She had this idea that something terrible had made Shirley split. She didn't really know what it was, so Shirley would be questioned pretty ruthlessly about things that her mother might have done to her, with a lot of specific suggestions by Dr. Wilbur. And what she, quote, remembered, unquote, was her mother tying her up, sticking implements up her genitals, all kinds of really terrible things.
Rather than publishing her findings in a scientific journal, Dr. Wilbur approached a journalist friend, Flora Schreiber, about the possibility of writing a mass-market book. She agreed, but only if Mason's personalities had merged. 3 years later, Schreiber got a call from Shirley Mason.
Flora Schreiber came over to Shirley's apartment, and she'd had some sort of a fit. She fell down, writhing, and then jumped up and jumped all over the place. After that, she was integrated. That's the way it was described by Flora Schreiber.
Before Sybil, multiple personality disorder was so rare that only 100 cases had ever been reported in the medical literature. Less than a decade later, in 1980, the American Psychiatric Association officially recognized the disorder, and the number of patients diagnosed rose into the thousands. In the 1990s, lawsuits were filed by other MPD patients, many who also linked their disorder to recovered memories of satanic ritual abuse when they realized there was little evidence that such abuse had actually occurred.
Many women who went into therapy and developed what are today called false memories developed those around treatment for multiple personality disorder.
Today, MPD is not an official diagnosis. The American Psychiatric Association now calls it dissociative identity disorder, or DID. But what about Shirley Mason? Dr. Spiegel remembers that his father doubted she had multiple personalities, and that was nearly 60 years ago.
He referred to her as a brilliant hysteric. He felt that Dr. Wilbur tended to pressure her to exaggerate on the dissociation she already had. So she was capable of it. She was very hypnotizable.
I think it's important to look back at Sybil because it's important to understand which stories are true and which are false, because in some cases, like this one, they're not just stories. I mean, they actually end up affecting the law, affecting mental health, affecting political decisions. And the stuff that sounds the most dramatic and yet the most credible at the same time is probably the most dangerous.